In this video, we're gonna go over the 5 key things that you're gonna wish you knew if you didn't know these already, going into dental implants and getting your smile transformed with dental implants. If you're trying to stay out of dentures or you're trying to get out of dentures with dental implants, this video is gonna be super important. I promise you, you're gonna avoid having a smile that ends up looking like these two. This is what happens when you go to somebody that didn't fully grasp this process. And I bet these two individuals wish they would have been able to watch a video like this. So that's why we're creating it. So if you're wondering who I am, I'm Dr. Olson, or Dr. O, from Innovative Dental in Springfield, Missouri. I help people from all over the country and local patients stay out of dentures, get out of dentures with dental implants and screwing in a set of teeth the very same day we take the teeth out. We have a webinar on Thursdays from 3 to 4 every Thursday where we do it live, so I would love to meet you there. But let's jump into the video and talk about these 5 key things you need to know to avoid a total implant dental disaster. Point number 1 is photos. I know that kind of seems basic, but it's true, right? Go to Facebook, go to Instagram, go to YouTube if they've got a YouTube channel, go to their website, and you wanna see photos before and after. You wanna see patients that have had similar conditions to what maybe you're struggling with. You wanna see a lot of them. It just doesn't need to be 1 or 2. It needs to be dozens, really, right? You don't wanna be the first one. Obviously, we all start somewhere, but I'm just saying we learn a lot. Experience is a good teacher. Go to find somebody who's got lots of photos, who's obviously focusing on this as a treatment. And you'll notice in our Instagram, right? It's an emphasis of ours. You're gonna see a lot of before and after photos. Check our Facebook, our website, right? We're gonna have lots of evidence showing you that we care about this procedure. Don't just take before and after photos. The fact that we just take them is a good thing, not that we just show them, right? If we're taking them, it means we're really concerned about doing quality work that we are proud of showing. By the way, we get permission from every one of our patients. If you don't want to have us share your photo, we honor that. So point 1, make sure you see plenty of quality photos showing what you want to see happen for you. Makes sense, right? The other one is reputation. So I think of like testimonials, I think of online reviews, and I think maybe like references. Those are kind of the things that would make up a reputation, maybe what the community might say about the work, right? If you got a referral from a friend, that's awesome. But I would say make sure that you go and see their Google reviews, right? Sounds basic, but read those reviews. If they don't mention any implants, that's not probably the place to go. But if they are like ours, and you'll see many other offices have this, you can go and scroll and you can find reviews that go over dental implants and the process and how they were treated. Then you want to see testimonials, see videos of people being interviewed with their smile transformation with dental implants, so you know that that's available to you. Another thing would be references. If a patient asks me and says, "Hey, Dr. O, would you mind sharing with me a few patients that are comfortable speaking to me?" Of course, I've got dozens of patients that were so excited that, matter of fact, one of the ways they said thank you is, "Let me know if you ever need anything. I'd be happy to share my experience," right? That's the best compliment when a patient does that. Obviously, they're extroverts and they're happy about sharing it. Okay, so photos, reputation, and then we come to our 3rd key thing to avoid a dental implant disaster, and that is going to be the process. Why is that so important? Well, we go through this every Thursday on our live webinar at 3 o'clock. Another plug for that. Why is the process important? Because if it's going to take a full year, if you're not going to get a screwed in set of teeth the day you have your teeth taken out, you want to know, are they going to place 3 implants or 6 implants or 4 implants, or why are they choosing certain number of implants? Where the teeth are going to go, what shade of the teeth, what smile design is going to be. The process, the digital technological advancements allow us to be very detailed. And I go over all that, like I said, in the webinar, but you want to ask the doctor, hey, what's your process for doing this? How many visits? We do this in as little as 3 phases. It's initial design phase or planning phase. We have your smile day, and then we have a completion phase. So three phases. We try to make that short and sweet. It's as little as 4 to 6 months. You have screwed in set of teeth that don't come in and out during that process. So you want to know about those type of things going into it. You want to know that you're not going to be just treated like a machine, right? You're always getting 4 implants. You're always getting 6 implants. So you want to understand the process. And then you also want to know how many providers. So our 4th key thing to know is how many providers are going to be involved in this. And I'm going to argue that the fewer the better. Why do I say that? Because the more cooks in the kitchen, the more issues you're going to find with communication, quality, efficiencies, cost, right? It's going to cost you more to have more cooks in the kitchen. The single provider protocol is what a lot of places that focus on this are going towards because of the ability to control quality and cost. Those are huge advantages for you, the patient, and the practice. For me, in our office, it's a single provider system. I'm the only doctor currently that does this. We have another doctor in training, but we are going to be able to provide single provider protocol, meaning you are with one person responsible for the implant placements, the teeth removal, and your smile that's going to be screwed in. So that's awesome. It means you don't have to have multiple people to worry about and figure out and pay. So you want a single provider. That's my opinion. I think you're going to get a much smoother result than if you're bounced around to multiple places. And now we come to our fifth one. It is the lab, right? Okay, so the dental laboratory that's going to fabricate your smile. I would want to know who's doing this. Ask the doctor what lab is going to be making my smile. If they hesitate, right, or they don't have a system in place, they won't know who the lab is, right? But if they say it's this lab and they've done great work for us before, matter of fact, here's some examples of it. So the dental lab is so important that we've worked diligently to bring this in-house. Why is that important for you? Because it streamlines communication. It's similar to the single provider idea, right? If one person is involved in doing the procedure, we have a more streamlined approach with less issues in communication and quality. Same thing with the dental lab. If we can not have to ship your case in and out of the office to either a local lab or one halfway across the country, we can now control the aesthetics, the quality, the return time, and give you the best results. Matter of fact, look at the detail of the teeth we're able to create for our patients in our own in-house lab with our own innovative tooth fairy here. Check her out, designing teeth, developing the smiles right here in just a short amount of time to turn around for our patients, even those that are from out of state. So that's how we're able to control the process here at Innovative Dental. So make sure you ask, what lab are they using? Hopefully they have an in-house lab. I think that's probably the best. Now these two photos, I'm going to give you a little heads up. This one here, you can clearly tell that the smile looks bad. And you may not know why. You may think it's the set of teeth that were created on that, which I would argue is probably true. They're not great teeth. So the prosthetic is poor. Here's the kicker, okay? The implants weren't placed correctly. So, it's hard to make a good set of teeth on poor implants. So the process matters, the planning matters, the technology utilized matters. So because that was not thorough and done in advance, right, like we do here at Innovative Dental, I'll once again plug for the Thursday webinar, Thursday at 3, because there wasn't thorough planning, the implants were placed wrong and it was doomed to fail from that point forward. There's no way to recover. So matter of fact, the only way to fix this smile, remove implants and put a new set of teeth in. I want you to see this other patient. It's a similar scenario. She went to an oral surgeon, got these implants placed, but they weren't placed deep enough. Because the implants weren't deep enough, the smile couldn't be made up high enough. So now it's down low and it's forward. She's pretty self-conscious about it, understandably. It's not a simple fix now because we have to go back and actually remove implants and recreate the whole smile. And obviously you can see the teeth don't have detail, and you definitely want to have detail in the teeth. It's just a solid pink. Hopefully this video has been helpful. I encourage you to follow those 5 key things that I've shared with you throughout this video. When you go and search for your doctor you're going to trust with this, we would love for you to trust us here at Innovative Dental. Like I said, go to the webinar, but you can go to yoursmiledestination.com. You can set up a virtual consultation with me, and that's how we kind of start the process. Once you're going, yep, let's go ahead and get this smile done, then you fly in here or travel in here and we're able to take your records. And then the second visit is your smile, and the third visit is the completion. Thanks so much for watching. I hope this was helpful. I would love to help you with your smile. Please share this with somebody if you know that they're struggling and looking into this. I hope it's a great resource for them to avoid the headaches that these two individuals made. They would tell you this too, right? Avoid this problem by doing some research in advance and following these 5 steps. And then hopefully you get an awesome smile like this person here. And I can't wait to help you with your amazing smile. Matter of fact though, keep smiling. It looks good on you.